Master of Agricultural Science, PhD. For the operator, please share the Mr. Wahyu's CV. Okay, so Mr. Wahyu is a lecturer at Food and Agricultural Product Technology in Faculty of Agricultural Technology, Universitas Gadjah Mada, and he got her last education at PhD in Science of Food Function and Health at Tohoku University, Japan last year, and recently he also is researching the nutritional changes and anti-metabolic syndrome effects of germinated brown rice from selected Indonesian paddy varieties. And he also have about more than 10 publications and involved in 3 projects. And don't have to wait any longer. Wahyu Dwi Saputra, STP Master of Agricultural Science, PhD. The time is yours.
Okay, thank you very much, Master of Ceremony, for the time. And in this afternoon, good afternoon, everyone. I will guide you to the lecture by Dr. Jahidul Islam from the Tohoku University. He will talk about the fecal microbiota transplantation for livestock's animal well-being. So, hello, Dr. Jahid. Can you hear me?
Yes. Hello, everyone. Can you hear me?
Yes, it's very clear. So I wish your happy and greatness condition in Sendai, Japan. So I guess that today is the maybe the peak of the summer season. Is it correct?
Yeah.
So I looked that you wear the short shirt, so maybe it's a little bit hot
there. And I have a fan. Yeah.
So I remember this condition back in that time, and I do miss a lot of this condition. So before we continue the lecture itself, so let me introduce the curriculum vitae of Dr. Jahidul Islam first. So Dr. Jahidul Islam got PhD, honestly, from the same laboratory. So Dr. Jahidul is my senior in Laboratory of Nutrition from the Tohoku University, Japan in 2017. And after this, he got some great fellowship, including the postdoctoral fellow, and also now he is the assistant professor in the Laboratory of Morphology, Graduate School of Agricultural Science, Tohoku University, Japan. Until today, he already published in 16 publications and give several presentations in the international conference. And he also got the scholarship from the Japanese government to continue in the PhD, and also the third Sasaki Young Investor Award in 2018. So for the efficient of time, please give the lecture. The lecture time is for 1 hour, and after this, we will move to the question and answer session. So Dr. Jahidul Islam, the time is yours.
Okay, thank you. So can I share my screen?
Yes. So can you share your screen?
Okay.
Okay, please.
So can you see my slides?
Yes, now you just need to slideshow.
Okay.
Okay.
Hello everyone. And Assalamu alaikum. I am Jahidul Islam. I am very happy to talk you there, and it's summertime here, so a little bit warm, so I wore the t-shirt. And it's really a nice talk. It will be a very nice talk for me, and it's a great opportunity for me to share my research and my recent publication with you. And I also enjoyed my previous speakers, and the day before, in yesterday, I also joined some of the lecture, and I really appreciate, and it's really very interesting for me. As your course is about summer course for smart agro industry, most of your presentation is about the agricultural technology and how to make a precise agricultural sector or this like this. But my talking will be a little bit different from your study or even today's site. So I will also talk about one of the agricultural important thing, but it's not for agriculture directly, but it's livestock. So well, I will try to I will try my best to show and to explain all my discussion in a simpler way and in a short and slow way, so we can interact very well. So today I will talk about fecal microbiota transplantation for livestock animals' well-being. My presentation outline is basically divided two parts. So in first part, I will talk about introduction of livestock industry, in where I will talk about importance of livestock animals. I will talk about challenges, and I will talk about livestock diseases. In my second part of my talk, I will talk about fecal microbiota transplantation and how I conduct research in this using this technique. And I will discuss about our results and how we can use this technology for livestock disease treatment. So introduction is about livestock sector is considered as the backbone of a global food system. It contributes to ensure food and nutritional security and agricultural development. Ruminants like cattle, sheep, and goats convert a large amount of pasture forage and grass or byproduct feed, as well as some non-protein nitrogen source like urea into, most importantly, meat, milk, and wool. So according to Food and Agriculture FAO, livestock industry contributes about 40% of the global value of agricultural output, and it supports the livelihood and food and nutritional security of almost 1.3 billion people. However, increasing income, changing food style, and of course the population growth have increased the demand for livestock industry. And it's also becoming a very fastest growing agricultural subsector. What are the major livestock farming? Among the livestock farming, cattle farming, pig farming, sheep, goat, and rabbit are very well known. The gridded livestock data map, they showed the global distribution of livestock animals like cattle and pig. So you may see that the figure A shows about the cattle distribution, cattle farming in the world, and B shows the pig. So maybe cattle is very higher in Indian subcontinent, and maybe in Indonesia, you have also a large amount of cattle farming. But there is some difference about interregional difference in livestock production system. It depends on the culture or ecological difference and human human presence. So it depends on the culture and geographical location. What's the benefit? What's the importance of livestock diseases? One of the major livestock importance for human is that it's the source of protein like meat. So meat is a valuable source that we obtain from livestock animals with a high biological value of protein, iron, vitamin B12, and other vitamins, zinc, selenium, and other micro and macronutrients. So what is the benefit of eating meat? Eating meat is they can prevent anemia, they support pregnancy, they support cardiovascular health, and support overall physiological health, and they treat insomnia. So the right figure shows how the meat production will be increased even after 10 years later. So the meat from beef and veal, pork, or poultry. Poultry, even though it's not another good source of meat, but they are also increased and sheep. So this all meat production and the demand will be increased even after 10 years. And interesting thing, this growing are very most their growth occurring will be more higher in Asian country. For example, the meat from the world, it will increase about 41 MTCOE to an estimated 382 in after 20 years. What is the others importance of livestock and especially the animal-based energy in next 100 years? So this is very interesting that even after 100 years, the overall demand for this meat will be increased. So in agricultural sector, livestock farming will become a very crucial farming sector for human civilization. And this long-term projection study shows that especially the middle income countries, the meat production or meat demand will be increased, and even after 2075, the lower middle income they will lead to grow much more this animal-based food production. So based on this, in overall, if we say that in animal farming or animal-based food energy, energy is a very, very important component for our life. But the livestock industry is not beyond the challenges. There are still many challenges in livestock farming. For example, the environmental impact. As you know, that livestock industry is a significant contributor of methane gas emission, greenhouse gas emission, or deforestation, and they need a lot of water. So, and the raising the large number of animals requires large amount of feed, water, and so there is there lead to a very environmental degradation and habitat loss. And production cost. So feed, labor, and the energy cost have been increasing, and the putting financial strain on livestock, especially small scale operations. So the global demand and supply imbalance is also challenges for livestock industry. And technology adaptation. In livestock industry faces challenges in adopting modern technologies to improve the efficiency and sustainability for the animal well-being. Especially those are smaller producer, they have with limited resource, they are not eager to adopt new technology. Disease outbreaks. So disease outbreaks is one of the major challenges in livestock industry, as because livestock are very susceptible to various diseases, and they also facilitate to spread rapid infectious disease. Maybe you all know that avian influenza or foot and mouth disease or swine flu had a very severe economic loss in the livestock industry. But this disease can also transfer to human. So it's also very serious concern for human public health concern. Even if we eat the contaminated meat products, those are contaminated with some pathogen like Escherichia coli or Salmonella, is also very major challenge for human also, because the human can become ill after eating this foodborne pathogen. And the recent and the most important is the antibiotic resistance. The overuse of antibiotics in livestock to promote the growth and prevent or treatment in diseases can increase the rise of antimicrobial resistance bacteria. So this antimicrobial resistance, maybe I know all of you know about it, that in where the bacteria or the microorganism can survive after given the antibiotics. So this antibiotic resistance is a big concern for livestock industry. And this also a very significant threat for human health, because this resistance microorganism can transfer or can be transmitted to human through the food. And in this figure, I have shown the current antibiotics uses in livestock industry. The antibiotics is also important. We cannot omit or we cannot left their benefit. But my concern is overuse or excessive use of antibiotics. It is found that the global average of annual consumption of antimicrobials per kilogram is very high for cattle, chicken, and pig in industry. And this world map of antibiotic uses shows the higher amount of antibiotic uses in different country. Maybe you have find out the most of the country those that uses the antibiotics. So now the question is how we can overcome these challenges. Will we stop the antibiotics? As I said, we cannot omit the beneficial benefit of antibiotics. We are talking about overuse of antibiotics. So if we can adopt some technique that can prevent the overuse of antibiotics, that will be very interesting. So to overcome the challenges of overuse of antimicrobial in livestock, especially livestock disease cases, we can consider fecal microbiota transplantation (FMT), and I think it will be an excellent option for to cure disease without using antibiotics. So from now, this slide, I will use this fecal microtransplantation, but in shortly, I will use this term FMT for short version. So don't be confused about this word. So what is FMT? FMT is the basically transfer of stool or feces from a healthy person. So I can from a healthy person to a diseased person. So in the figure, in the left side, this person is very healthy, and the right person, he has some gastrointestinal problem, and they have their microbial composition is changes, so they suffer in several illness. So if we can collect feces from this healthy person, and we can make some this suspension, and if we transfer this suspension to the diseased person, their microbiome can be changed and they become healthy. So this is the technique of fecal microbiota transplantation. And the major aim of using FMT is to restore the healthy or normal microbiota of the recipient or the diseased person. History of fecal microbiota, history of FMT. This concept is not new. Basically, the first record of this FMT has been found in 4th century in China, in where the human fecal material they called yellow soup, and they use this for treatment of the patients of severe diarrhea. Until in China, the Ming Dynasty, until the 16th century, this type of fecal material, they are all fermented fecal suspension. They are used for gastrointestinal diseases like diarrhea, constipation, and abdominal pain. So basically, we can say this is the old wines in new bottles. So this technique is not new, but now it's become very popular. So in modern days, in recent times, especially in Eisner and his colleagues in 1958, they first uses FMT for the pseudomembranous colitis treatment. And this is the first report that we find from the medical literature. And in recent times, the FMT is clinically approved for Clostridium difficile, recurrent Clostridium difficile infection in human. So why FMT is now a very relevant technique? So now we have some latest research technique like metagenomics and metabolomics, proteomics. So using this latest technique, we can understand or we can reveal the mechanism, efficacy, and or side effects and long-term evaluation of this technique. And using this technique, we can make different types of FMT. To become more precise and in different formulation, we can make it. As I said before, that this technique, FMT technique, is approved by FDA for the Clostridium difficile infection in human. So I will explain a little bit about this diseases. So Clostridium difficile infection is mainly occurred in the large intestine by the bacteria Clostridium difficile, and generally this disease occurred after long-term use of antibiotics, and they reduce the normal bacterial population in the intestine, and they facilitate the growth of Clostridium difficile. And it's very common, those persons who are affected by difficile, they have a chance to recurrent these diseases. So when this disease is recurrent or frequently occur, in that time, the antibiotics cannot work against these diseases. So interesting thing, the FMT is become very effective in this RCDI treatment. In human, this FMT technique is not only used for recurrent Clostridium difficile, but some other human study or human case disease cases, this technique is used, like inflammatory bowel diseases, metabolic syndrome, cancer, and neurology. Even a most interesting thing in neurological diseases, this type of technique is now using. So now the question is how this FMT can be an alternative to antibiotics. So we said that we can overcome the overuse, or we can reduce the antibiotics uses. So how FMT can reduce the antibiotic uses? So if we compare how antibiotics mechanism, how they work, and if we compare how FMT works, so maybe we can easily understand. So antibiotics, basically, they reduce the harmful bacteria or gram-negative or gram-positive bacteria by attacking their cell wall. They can interfere the bacterial reproduction, and they can inhibit the protein synthesis. So by this way, they can work against the bacteria. How about FMT? FMT, basically, one thing they do, they make the balance of gram-positive and gram-negative bacteria. They changes the microbiome to a balanced state. So microbiome, this term I will use many times. So I will give a short note about microbiome. Maybe you know that, but I will explain a little short note. So microbiome is basically called the overall microbial community, like fungi, bacteria, or virus that exist in the GI tract, in the gastrointestinal tract, even skin and oral and the urogenital part. However, the most abundant bacteria we find in the gastrointestinal tract, and most abundant and most diverse type of microbial presence in the GI tract. Towards the function of microbiome. So the major function of microbiome is to help in food digestion. And during this process, they made many small molecules that we call metabolites. And these metabolites can use by the host. So for a healthy life, we need a very good balance in our body for microbiome. So if this balance is changes, then we are attacked by the diseases or by the overproduction of some certain bacteria. They can make diseases in our body. So for a healthy life, we need a balance of microbiome composition. So FMT basically can make this balance. So how? Now the question is how they can change the balance. So this picture seems a little bit complex, but if you go through by maybe I'll explain this figure at first. So what happened if we deliver FMT from a healthy person to a diseased person? So is it very easy, or is the recipient is very friendly to receive the foreign materials? And the answer is no. So it is this is very challenging, because the donor and the recipient. Donor is those who give the feces, for example. The feces. And recipient is that those person receive that feces material. So this is not easy, because this is some foreign materials that coming to another person. So even we have some own bacteria, own gut microbiome. So at first, there is a chance to reject the foreign materials, because the recipient they have some certain types of microbial presence. So when we give the foreign or the donor microbiota, the recipient, they can reject. Some of the microbiome they can reject, but after few days or after few time later, they can become they can persist in a certain time. After a certain time, they can persist. Then they can coexist. So the main target is the coexistence of the donor and the recipient. So those are coexist, the matching. They can survive in the recipient, and they become as a novel strain, and they can make the balance. So there are several steps to become a novel strain after receiving the donor microbiota. So at first, the recipient, they reject some of the microbial composition. After that, some of them are persist, and finally, they are coexistence, donor and recipient. So this is the figure. If we go to inside, for example, if we give FMT to a person, and what happened that recipient. So this is the picture, for example, from the gut. I mean, in the gastrointestinal tract. So this is this blue color. They are recipient microbiota, and the yellow color is donor microbiota. So they are already existence, and they are newly newly invade or newcomer. So this newcomer and the existent microbiota, then they make some coexistence that we called quorum sensing. So they can share some of their behavior, some of their proteins inside between them, and then they can make some good combination, and they can produce some important metabolites from the bile acid, for example. Or in this figure, there is no talk about short chain fatty acid, but they also can help to make short chain fatty acid. So after this type of metabolites are produced in the GI tract, they can interact with the host immunity, or they can insert into the GI tract, and they are involved in host immunity. So this way, basically, if M2 works, so at first they have to make good relation with the recipient existent bacteria. Then they make some communication between them, and they make some important metabolites, and these metabolites lately interact with host immunity, and in this way they reduce the pathogenic or abnormal microbiota, as well as they regulate host immunity and inflammation. So this is the main way FMT works this way. So now I will talk about the diseases. I explain how FMT works and how it can be used instead of antibiotics. So despite the development of new vaccine, and we have a new technique, livestock industry has not beyond the diseases. In cow, mastitis and bovine spongiform encephalopathy, foot and mouth disease, bovine pneumonia, anthrax, and diarrhea are very common diseases. And in pig cases like swine dysentery, swine fever, and influenza, this type of disease is very common. But in today, I will specifically talk about diarrhea cases in cattle industry, but I'll talk about calf, the smaller animal in the cattle industry. So from this slide, from this on, I will talk about calf diarrhea. This is very cute, I think, and this is very most of very young animals calf that you called. So calf diarrhea basically is very common diseases in cattle industry. And these diseases can occur by both infectious and non-infectious factor. And these diseases can be vary by geographical location, farm management, and the farm size. And for treatment purpose, there should be a good understanding of how these diseases occur, and is there any presence of co-infection, and how is their environment or the farm condition. So all this type of all this type of information must be considered during calf diarrhea treatment. What is the symptoms of calf diarrhea? The major sign of calf diarrhea include water deficits, sunken eyes, weakness, and depression, and inability to stand. So this is very healthy calf, and this is a calf who suffer in diarrhea. What's the causes of diarrhea? So in my previous slide, I showed that it can be caused by infectious and non-infectious factor. So among the infectious factor, bacterial, it can be caused by bacterial pathogen, viral pathogen, and protozoal pathogen. So in bacterial pathogen cases, Salmonella enterica, Escherichia coli, and Clostridium perfringens are very common. And in viral cases, bovine rotavirus or coronavirus and bovine viral diarrheal disease are very common for these diseases. And in protozoal cases, the Crysporium parvum and Coccicidia parasite are very common pathogen that can cause these diseases. So not only this single pathogen, but the combination of even bacterial viral or bacterial viral protozoal all can cause these diseases. However, non-infectious factor, the major causes can be insufficient uptake of milk, like colostrum, hygiene, number of animal, or stress, or seasonal variation is very common for occurring diseases. For example, in winter season, there is a higher chance of calf diarrhea. So what's the common treatment options for calf diarrhea treatment in livestock industry? So obviously antimicrobials are the first choices for using for treating calf diarrhea. So antimicrobials like oxytetracycline or amoxicillin, this type of or streptomycin, this type of antimicrobials are very commonly used in this disease treatment. So some other non-steroid drug like ketoprofen also used for treatment of these diseases. And among not only this, some other alternative treatment options like beta vitamins, B vitamins, and fat-soluble vitamins administration can also shown beneficial effects in calves with chronic diarrhea. And so how we can use FMT in livestock? So in my previous slide, I have talked about FMT in human cases. So in livestock cases, using FMT is very convenient convenient compared to human. So for these treatment cases, sorry, how much time I have left?
You still have Around 20 minutes, Jahid.
Around 20 minutes. Okay.
Yes.
Yeah. So that the technique is similar as human. So if we collect feces from healthy calf and we make some juices, then if we transplant into the recipient recipient cases, so they can become cured. So this is the technique for using FMT. So for this, we need donor at first, healthy calf, and this donor must be free of common pathogen. They must be healthy. They should not have any history of diarrheal diseases, and the recipient should be the calf who suffer in diarrhea. So what we did in our research story. So at first uh, we are collecting donor selecting donor from 20 healthy calf, and so I said before that these donors they should have very well nourished, and they can be either male or female, and they should have free of conventional pathogen, and they have no history of communicable livestock diseases or other diarrheal diseases. And in recipient, we also select 20 recipient cases, and they are suffering diarrhea for mild to severe. And in this study, basically, we use this donor and recipient from the same farm. It, this is because the farmers are very concerned about pathogen transfer from one farm to another farm. So initially, we have to convince them that this is safe. So in this study, basically, we are emphasize on the collecting donor from the same farm. The same farm means they have the same type of environment. They are grazes. So uh, every recipient have different donor. So 20 donor is used for 20 recipient. So in step on, we collect feces and we mix with sterile saline, and we have make some juice, and we are putting into them insurins, and then interrectally we transplant into the calf. So this is the study design. Basically, at day 0 before FMT, we collect blood from them and for pathogen check and clinical for understanding their clinical or is there any systemic changes or not. And we also collect feces for pathogen test and for 16 is the ribosomal RNA polygon sequencing and metabolomics cases, metabolomics analysis. So this is the day 0. That means they are before FMT. So after FMT, we also a day on, we also collect feces for some 16S ribosomal RNA sequencing and metabolomics study cases. And we also collect after 7 days. We also collect blood and feces again for the same purpose. And then we observe that some of the calf uh, are becoming healthy and some of them are not. So how we can understand they are this FMT is successful or this FMT is unsuccessful? So obviously it depends on the diarrheal symptoms. So if the diarrheal symptoms still present and they are still very weak, unable to stand, and the veterinarian doctors find that they are not effective. So this is the result of FMT based on the diarrheal severity. So this three, if you see we call score 3, if the feces is very liquid or watery, and score 2 is it muddy, and score 1 is normal. So based on the condition of the fecal, we have make this score, and if the score is more than 2, and then we called it still diarrhea. For example, in calf on, the day 0, they have higher score 3. That means they are liquid, and after day 1, the fecal condition become normal, score 1, and after day 7 it's normal. So if you see, the FMT works very well. So their feces condition is watery, but this is normal, so they become healthy. So in calf 2, the fecal condition is also improved, but in calf 3 is not changes, is almost same. And even calf 4, the fecal score is not changes, and calf 5 is not changes. And figure 6 is changes. Figure 7 looks very good, so it's totally improved. So before FMT is the very severe condition, but after FMT it become healthy. And calf 8 also become healthy, but calf 9 you show that it's not improved after day 7, even though it's lower, but it's not improved. Calf 10 is looks good. So in from FMT from calf 1 to 10, if you look through again, so calf 3, 4, 5, and calf 9, the diarrheal symptoms is not gone. So we call them unsuccessful. How about in calf about 11 to 20? So in these cases, most of them are improved the fecal condition. 11, 12, 13, 14 looks good. 15 is especially very good. 16, 17, the score is lower. In 18, is same. So that means there is no changes in their feces condition. So they are not recover from diarrhea. And figure calf 19, they are healthy, and calf 20 is the severe higher condition. They are not improved. So from 11 to 20, calf 18 and calf 20 are not recovered from diarrhea even after giving FMT. So the overall, we find using FMT is 70% we successful and 30% we unsuccessful. So our FMT overall efficacy is for 70% in this time and is unsuccessful in 30%. So this is the result of FMT. This overall diarrheal score. In successful FMT, the score become low. That means they become healthy. And in unsuccessful FMT, the score become increased. That means their condition is not well. And as I said before, we need to check the pathogen presence before and after FMT. So for example, in successful FMT, there were many pathogen presence in the calf, in different calves. So this is the calf number 1 with 14. As I said, we successful in 14 calf cases. So after day 7, most of the pathogen are gone. And in unsuccessful cases, there are still very higher number of presence of bacteria before FMT, but after FMT, there is still presence of some common pathogen. Still presence after FMT. Then we have checked the systemic parameter for evaluating the FMT. So to confirm that yes, FMT does not affect the systemic immune system or systemic system. So we have checked some blood parameter for like total protein, total cholesterol, hemoglobin, albumin, and gamma GT, or white blood cell, red blood cell. We are checking this blood parameter, and we don't find any abnormalities in the systemic immunity. So this implies that FMT is safe, that they don't cause any systemic abnormality. So now we are using some of the recent omics technology in this study. Mostly, I will explain about metagenomics and metabolomics cases. So in shortly or in simple way, if I want to say about metagenomics. So this is basically called the known the structure and the function of the of the bacteria. So if we study the function and the structure of the bacteria, we can call it metagenomics. So for this metagenomics, we are using this technology, next generation sequencing, and we use this next generation sequencing based on the bacterial 16S ribosomal RNA amplicon. So using this bacterial 16S ribosomal RNA, we use this technique, metagenomics. And another technique we are using that we call metabolomics. So metabolomics is the presence of all metabolites, small molecule, in the biological sample. So in our study, we are using feces. So our main point was fecal metabolomics. So this small molecule, those are presents in the feces, and they can be measured. They can be their level or their presence can be checked by capillary electrophoresis, time of flight mass spectrophotometry method we use to measure their level. And so metagenomics and metabolomics techniques are we use to further comparing their efficacy, FMT efficacy, basically. So this is the short note. If you are interested about 16S ribosomal RNA sequencing, basically using this gene amplification method, we can compare the whole bacterial presence in a sample. You know that in the we have a lot, or we have trillions of microbiome presence in our feces. So this is very tough to estimate or very tough to culture to know their presence, their level. But if we can check this gene using next generation sequencing, so we can get the information about the presence of relative abundance of all bacteria in the sample. So this technique is very easy, and this technique can give us very information about hundreds of sample simultaneously, and in a very short time we can get the result from using this technique. So for this technique, basically we use very common technique at first. Before next generation sequencing, we use PCR, that is called polymerase chain reaction. So maybe some of you know, most of you know about PCR. Is very common, especially we can amplify very small amount of gene in a very larger amount using this technique. For example, in forensic technology, if we have very small amount of sample, we can amplify using this machine. So this machine can amplify also the bacterial gene. So using NGS, we can understand how much or how many types of bacteria presence in the sample. So this short notes basically I give you to give you overview to understanding of metagenomics understanding. So now we come again about the result like alpha diversity. And alpha diversity is used for understanding the efficacy of the FMT. So alpha diversity basically is a term to understand the difference within a sample. So this is very interesting. If you look through the picture, you'll understand that at day 0, this is a donor, right? So donor has very higher number of index. So the higher number means their microbiome composition is very high. Many types and many variety of bacteria presence in their feces. And this is the recipient. At day 0, they have very low amount of low types of bacteria presence in there. And after day on and day 7, this level is increased. So the FMT, the donor FMT, is increased after day 7 in the recipient. Yeah. So if you consider in unsuccessful cases, so the donor is selected is very high, and at day 0 before FMT, this become very low, and after day 7, it's almost same or little bit increase. So the FMT can change the microbiome of the recipient. Okay, so now we have another result. We called it beta diversity. So basically, this beta diversity can explain the similarity or dissimilarity between two communities. So this color, blackish color, they represent the donor. So this result is basically successful FMT. So in successful FMT, this is the donor, and this is the recipient. So before FMT, their composition is their position is far from donor, but interesting thing, after FMT, it become very close. It's going to close the donor. Donor position is same, but recipient is going to close. Over day 7. So at day 7, they become very close to the recipient. So we can say that the microbiome composition of donor and recipient after FMT, especially at day 7, they are not significantly different. I mean, they are very close. So this result confirmed that recipient after 7, they gained the healthy donor microbiota. So now the question is, what about in unsuccessful cases? Oh, sorry. So this is the another result of the recipient. So if you check the red is the before FMT, and the yellow is the after day 1, and this is it pink? This pink is day 7. So day 0 and day 7, they have a very long distance. So that means before and after, their microbial composition is significantly different. So if you say the recipient at day 0 and recipient at day 7, so they have very big difference. So they're totally different. So interesting thing in the unsuccessful case, basically we didn't observe the position change of the recipient somehow. So at day 7, in the unsuccessful cases, the position is not changed. So that means the microbiome of the recipient did not change it. So if we compare in the unsuccessful cases, the recipient before and after, their position is not changed. So that means in unsuccessful cases, the microbiota, the donor cannot change the microbiota of the recipient. And if you go through, this is the microbial composition. So as I said, in this technique, we can know many types and many variety of the microbiome presence in the body. So mainly we can categorize, we use these 3 category for understanding. For example, phylum level, family, and genus level. So if you consider the phylum, this is the successful group, and this is unsuccessful group. So in this green color represents the proteobacteria. So proteobacteria is a very source of gram-negative bacteria and very pathogenic bacteria. So this bacteria level compared to day 0, at day 1 and day 7, they are going down. But in unsuccessful cases, there is no changes, especially after FMT, they don't changes. And when we compare at family level, so the Enterobacteriaceae, this is also coming from Photobacteria. So their level is not changes, right? But in successful cases, successful FMT, this level is become low. Yeah. And in genus cases, the Previotola level is very high, but in unsuccessful cases, the Previotola level is very low. So from this technique, from this result, we can calculate what type of bacteria are increased, what type of bacteria are decreased, and how they are become convenient for understanding of the FMT efficacy. So from this result, we can show that if the donor is not selected appropriately, there is a chance of FMT unsuccessful. And it is important. So in our study, first study, basically, before starting the study, we only checked the classical pathogen test. So this classical pathogen test is not enough for understanding good donor. So we need to know more about the donor. And this is the donor composition. So maybe you can say why we use the same healthy donor, but they are become unsuccessful. As I said, even we select healthy donor based on commonly available pathogen, but this is not sufficient to understand that the donor is really healthy or not, because even though they are healthy, but there is a chance of very harmful or pathogen bacteria itself presence in the donor. So in future, we should be careful to selecting the donor. And this is the composition or this is the comparison between recipient at day 7 of successful and unsuccessful cases. For example, those are successful, they have a very good bacteria like Pseudomonas, Pseudomonacoccus, and Colensella. This type of bacteria are useful for short chain fatty acid production. And unfortunately, in unsuccessful cases, there is a higher chance of Spirochaeotes presence. So this bacteria is responsible for very well known for diarrhea. So they are not gone after FMT. So we can understand why they are unsuccessful, and these recipients are unsuccessful. And then we check the. Sorry, maybe it's the time is 1 hour is over, so maybe I will take some few moments to finish it. Is it okay?
Yes, of course.
Okay. Then we check about the metabolomics. As I said, that metabolomics is the small molecule presence in the sample. So we have checked metabolomics, and in total we have find 366 metabolites presence before and after FMT in both successful and unsuccessful FMT. So I will not go through the whole study, but I will say that the metabolites composition can be changed after FMT. So this is another mechanism of understanding the how metabolomics are affected by FMT. So for shortly, if we discuss metabolomics, I can focus on amino acid. So you know that amino acid is very important metabolites for our health, and it gives us energy, and they are involved in some transport system, signal transporters. So if we see the amino acid composition in successful and unsuccessful cases, so at day 7, this level is very low in successful. But in unsuccessful cases, the amino acid level is very high. So that means in unsuccessful FMT cases, the recipient cannot use the amino acid, so they are excrete. But in successful cases, they are using this amino acid. As a result, they can produce energy and they can utilize uh, for um, for their betterment. So we can say in metabolomics that amino acids are affected by FMT, successful FMT and unsuccessful FMT. And this is another study, basically another way. In these cases, so maybe now we can understand that how we perform the experiment and how we check the mechanism of successful FMT and unsuccessful FMT. Because even we think that FMT is very good, but somehow we are failed, we are unsuccessful in certain FMT. So in this study, we will also give some information for the other people for in future study how we can predict the FMT efficacy. So for this purpose, we collected another 180 calves from diarrhea and healthy sample, and we perform some machine learning approach, and using that we find two important bacteria like Campylobacter and Sporobacter. So Campylobacter is very common for diarrheal sample, and Sporobacter is very common for healthy sample. So if we somehow, or if we can make some technique to check these two pathogen, not pathogen, sorry, to this microbiome before FMT or in the donor. So their number or the presence, if low Campylobacter with high Sporobacter, there is a chance of successful donor, 100% donor. That donor can be succeed the FMT. But if we select the donor with higher Campylobacter but lower Sporobacter, there is a chance of unsuccessful. So using this type of machine learning approach, we find these two important bacteria for successful FMT prediction. So I'm almost coming to my end of my slide. So what's the major findings in my in my study? So from this study, as I said, we find 70% efficacy, but we failed in 30%. And we have find that Campylobacter, Sporobacter, and Pseudomonas and Lactobacillus and Sporocereus, this type of microorganism, a presence or absence in the donor and recipient can make success or failure of FMT. And metabolites, especially amino acid, is very important for understanding successful and unsuccessful FMT. So for confirm 100% success rate in calf diarrhea treatment, along with common pathogen test, we should consider 16S ribosomal RNA sequencing to understand the donor. So we think, or we believe that FMT is a promising treatment option for calf diarrhea, and it can be used beyond antibiotics treatment. And FMT is very easy to perform in livestock cases, especially in cow, but compared to human. But for example, in human, we have to take many measures, many formalities. But in calf, it's very common to use a push or interrectally. So this technique can be used for animal welfare and profitability. And the overall importance, basically, of using FMT in livestock industry, we can say that in shortly or in word, we can say that FMT can restore the normal microbiota, and they can eliminate very harmful microorganism that cannot, by using the antibiotics, we cannot eliminate that harmful microorganism, but using FMT, we can make changes, or we can eliminate that harmful microorganism. So FMT can be an alternative treatment option for to restore microbiome of the disease cases. So our current study. So as I said in our um, previous study, we only rely on common test. But after in our next experiment, we check both a common pathogen test, and also 16S ribosomal RNA check. So and using these two technique, we have make some donor bank. We call it healthy donor bank. So we collect the feces and we check the pathogen and 16S ribosomal RNA sequencing and check the Campylobacter and Sporobacter and Pseudomonas. Then we make that this donor is very good, will be good. So we use freeze dry and we keep them at -80 and we are keep them in the freeze. So when there is some request from field, we just transport. We just send this donor feces to the field. So this donor feces is very convenient, especially because they are ready to use. So anytime they can be sent and very easy to transport because they are freeze dry. So there is no water in this sample. And we believe that they are giving 100% efficacy, almost 100% efficacy in the livestock treatment cases, in the calf diarrhea cases. So now we have made this type of donor bank. Yeah. All right. So this is one of my last slide. Maybe I have another two. So my today's presentation, I basically based on this research that we published last year. You can see my name here, but I'm sorry, I don't use too many technical words and research explanation rather than in text description. But maybe you are enjoying or you can understand what type of research we performed. And there is another study I find not from my site, is in USA and Italy. They are using FMT for the growth and growth performance of the FMT. So they also use FMT for their checking their growth and inflammation and oxidative stress prevention rather than calf diarrhea rather than diarrhea. So I think that FMT can be used not only calf diarrhea treatment but also for the well-being, for the growth and their healthy life. We can use FMT. And this is my laboratory picture and the laboratory members that we are working together. You can find me here. Yeah, and this is my professor. And this is the end of my presentations. And thank you very much for your patience. And I am very eager to discuss my recent talk. So I hope you also enjoy. So I'm finished.
Okay, thank you very much, Dr. Jahidul Islam, for the interesting topic and interesting lecture. So now we are turning to the question and answer session. There are 3 questions in the question and answer chat box. But before that, I kindly remind for all the participants who wants to ask about this topic, maybe you can write your question in the Q&A chat box, or I recommend you to directly open your camera and your mic and then discuss with Dr. Jahid directly. So maybe the first question is, how does the FMT compare to the other intervention for improving livestock gut health? This belongs to the Tabitha question. So maybe, is there any other livestock intervention than FMT, and what is the comparison to the FMT?
Sorry, you have asked me?
Yes. So how does the FMT compare to the other intervention? Is there any other intervention?
Other interventions like probiotics or prebiotics, this type of thing?
I guess that maybe probiotic is one of the well-known
Okay, all right. So I can say about probiotics. So you know that recent times probiotics is very become popular, not only for livestock but also human, right? But there is a good understanding about the mechanism of probiotics. So in probiotics, mainly we are given a certain or fixed microorganism. For example, we are giving lactobacillus, very common probiotics in very well-known probiotics. So if we give probiotics, there is a chance they are broke down by the gastric juice. And because you know that in our gastrointestinal tract we have a high pH, and sometimes the bacteria are killed in this one single bacteria. But when we give FMT, so they have a combination of millions types of bacteria. I mean, not millions types, millions number, and a good number of bacterial compositions. So they can recover, they can survive in the gastrointestinal tract. So comparing to probiotics, I think the this FMT much more effective. Yeah.
Thank you very much, Dr. Jahid, for the answer. Yes, I think that maybe probiotic has several drawbacks, including the stability, especially against the gastric juice, that maybe some of them will be killed or dead, so cannot reach the intestinal tract.
Yes.
Okay, so we move to the second question, or maybe I can invite Vera. Do you want to ask your question directly to Dr. Jahid? Can you open your mic? Oh, I think she already left the room, so maybe we keep this question first to our master of ceremony, Anaria. Do you want to discuss directly to the Dr. Jahid about your question?
Okay, yes. So thank you for the interesting presentation. And as explained before, I knew that antibiotics and FMT have different work system in treating the animal diseases. But I want to know between both of the techniques, which one is more effective, and what is the FMT's effectiveness rather than antibiotics? Like which one heal the animal disease faster? And I also curious about, does FMT application in other animal will have a same result? Thank you.
Okay, thanks. It's a very nice question. So basically, I said that we are not against the antibiotics. We are against the overuse of antibiotics. So if we use repeated antibiotics, sometimes the antibiotics don't recover the diseases. So in that types of cases, like in calf cases, calf diarrhea, we call them intractable calf diarrhea. So intractable calf diarrhea means this diarrhea, this calf, they have many times they have taken antibiotics, but the diseases not recovered. For human cases, we call it most important disease is recurrent difficile infection. So in that infection, antibiotics don't work, but FMT work. So if we compare directly antibiotics and FMT, we have another group in South Korea. Basically, they are working on these cases, and they showed that compared to antibiotics, FMT works very well. They also use calf diarrhea, and they have shown that comparing to antibiotics, FMT is very effective. So for your first question, I think FMT is better. And you have a second question is about, can you say one more time about your second question?
Okay. Does FMT application in other
Oh,
animal
yes. You said about, yes. We in our laboratory, we are now considering in pig industry, pig research, we are using FMT, and some of the other group, they are also using FMT in pig, especially in young age. So yeah, not only in calf, but in pig industry, FMT works well.
Good afternoon, everyone. Thanks to Professor Jahidul Islam for the nice presentation, sir. Sir, hi, I am Dr. Bipu from India, sir. Actually, we are working with the farmers as well as SAG women. So I have a question, sir. What are the remedial measures for FMT by using herbal therapy or ethno-veterinary practices, sir? Please, sir. Thank you, sir.
So I mean, you want to make this type of materials as a herbal composition or herbal medicine?
Yes, sir. This is herbal medicine or composition because most of the farmers are poor, sir. So definitely they should prepare their own, sir. That will be sustainable and viable, sir. Please guide me.
So now we are checking the composition of the microbiome, how much percentage there are certain type of bacteria should be present in a feces or not. So rather than the herbal, but we can say it is compositional because we are going to estimate the percentage of a certain amount of bacteria are present or not. But for in herbal cases, as far as I know, that the source should be coming from plant. So is it pretty common to extract some of the materials coming from animal that can be used for herbal medicine?
Yes, it can be, sir, because they may be prepared both herbal and also they may add some botanicals as well as animal extract also.
Oh, I see. So that's pretty interesting. I should consider in future. Yeah. But yeah, I think now we are making some technique that how that we are keeping them in -80, but -80 is not very common system to preserve because this refrigerator maybe takes very high cost. But we are now making freeze dry so that can be easily stored and easily transport. Yeah, and even keep in room temperature. So maybe in future, I will consider your comments to make is if we can make it herbal product or not. Yeah, but right now I can say it's very still we need further research to estimate the correct amount of the certain bacteria because this FMT is the collection of not only good but some of the serious microbiome can also present in the feces. So we should consider to that they are not any very serious pathogen are not present in the feces. Yeah.
Thank you so much, sir. Have a nice day.
Thank you.
Thank you very much, Dr. Bipu. So is there any participant who wants to ask directly to Dr. Jahid? Okay. So I will read the question from Vira because she cannot open her mic. So how about the efficacy of this method FMT? How many percent the efficacy? Is there any guarantee that this method will be successfully? Because of course there will be many screening for the donor itself. How about the
Okay,
efficacy?
so yes, I got this. I think it's very good comments. And in our study, basically, at first study, we showed that we are 70% successful. But this study we conducted in 2019 and 2020. So after that, we are conducting the similar type of experiment with different formulations. And most interesting thing in the last year, 2021 and 2022, we find 100% efficacy. So maybe if in your next summer course, I can explain my result, how we get 100% efficacy. So if we can select the best donor, we can confirm the efficacy. So now we are thinking, or now we are making some parameter to make or to select the super donor. So we can confirm that, yes, there's a chance of 100% successful. Yeah. And you said that bearing in mind that, yeah, so sometimes it's very important to check the harmful pathogen or antimicrobial genes are transferred. So this is very vital. So we should screening. We should confirm that there is no unwanted or harmful resistance gene presence in the feces. So right now, though, is the animal livestock cases. So it's not as in human, but in human cases, we must be more rigorous, most cautious. Yeah, but I think in livestock industry, livestock cases, we also should be more focused on the presence of some harmful pathogen or not. So for this confirmation, we now emphasize we should not only perform common pathogen test, we should also check 16S ribosomal RNA sequencing. So if we follow these two way, we can find out the best super donor.
Okay, thank you very much for the answer, Dr. Jahid. So we move to the next question. Comes from Nisa Alfinasari. You want to ask Dr. Jahid directly by open your mic, Nisa?
Okay, thank you very much for the occasion. Actually, I just curious about the basic things about FMT because I just know about the FMT and I just curious how you conduct the feces become the same like the pH, the anaerobic condition, also the temperature since during you take off the feces and transfer to the recipients like that. Thank you.
Oh, thanks for this time we don't consider about this thing. We try to use the fresh feces, so we do not consider some that type of environment, but we try to make a clean environment. Yeah, so so that's thing. We do not consider how much percentage we will lose or not, because we think that if we can transfer the certain amount or the at least amount, I think FMT will be work. But in future, maybe we should much more concern about maintaining aerobic or anaerobic environment to facilitate the good amount of the right environment for handling the feces.
Yeah, great. Because as I know that it will be related to microbial, so it will be related also with contamination. So have to consider about the pH also and the temperature on the anaerobic condition also.
Yes.
Thank you.
Thank you.
Thank you, Nisa. And now we move to the next question from Ina Santi. So I will read the question. It's about the how long has the FMT study in human, maybe in human, already conducted? If you have any information, and uh, about the technically, how long does this method or FMT takes by the recipient body to adapt for the adaptation?
So that's a very good question. So in our study, we are consider very limited time, only 7 days, as is shown, as I can show you in my. Yeah. So basically, we are only selecting 7 days. So as because this is the commercial farm, so we cannot continue this research for a long time because they need much more logistic support. But interesting thing, even in 7 days, we can get the result. So for animal perspectives, or this is very short time, and in short time we can get the result. And in human cases, basically there are many types or many way to consider the effectiveness, the safeness, the safety, and the long-term effect of the FMT. And there are many ways that in human cases this study is conducted. But compared to human, in livestock or in animal cases, this is very easy, and maybe we can omit some of the most strictness methods. Yeah. So in human cases, this not only for gastrointestinal disease, but also metabolic syndrome, obesity, or even neurological disorder. The FMT is now become very popular. Although only in the FDA, Food and Drug Administration, only approved FMT for Clostridium difficile infection, rather not the others. But maybe in future, upcoming days, this technique will be adopted, not only Clostridium difficile infection, but also other types of disease or in human.
Okay. And one other question from Ina Santi is, are there any negative side effects that cause after receiving FMT treatment?
Yes, there is a chance of negative effect, especially those are failed. So as I said, this study we conducted almost 2 years ago. This is the first study using FMT in Japan. So in that time, we were failed some of the treatment cases, but after that we are changes our method. So we then get 100% efficacy. So there is a chance, as I said, there is a long if we cannot make good donor, there's a chance of failure, and there's some side effects in the calf. But now we have overcome this situation, and we don't observe any side effects of FMT in our recent study.
Okay, thank you very much, Dr. Jayed, for the answer. So is there anyone who wants to ask about today's topic with Dr. Jahid? So I have one question. So in this case, your research is using cow as a juvenile or very young cattle. So how about if we use little bit old cattle or cow? Is the efficacy will be similar?
Yeah, okay, so that's very good. But if we consider the adult cattle or a little bit older cattle, so this is a little bit difficult to change the microbiome because they have very stable microbiome. So considering the adult cases, using FMT is a little bit risky because it may not work. But in young case, their microbiome is very naive, very not so complex, so it easily can transfer. So adult cattle is not supportive for FMDI. Yeah, because they have a very mature microbiome. Yeah.
Okay, I got it. So is there anyone who wants to ask or give comment about today's topic? Is it enough? So today's we learn a new thing about the fecal microbial transplantation. I think this is very interesting topics, Dr. Jahid. So many students and participants who discuss and they become very curious about your
Yes.
projects.
Thanks. I think so. So this is very interesting. I can share another information before other comments. So we are making this type of meta donor bank. So even, for example, we can transfer them to your country and you can use for your research purpose or for your farm. So now we are thinking that not only the same microbiome from one country can be transplanted to another country, because the animal transport from one country to another country are now increasing, right? The direct animal are coming from another country. So I think in future maybe we can send them to cure calf diarrhea in Indonesia.
Okay, we wish and we hope so. That very nice idea, I think so. So if there is no other person or participant wants to ask, we can finish today's lecture. And to the committee, I ask you to show the certificate or appreciation to the Dr. Jai. Or maybe Dr. Jahid, you can stop the share screen first.
Okay, so I will stop my sharing. Okay.
Yes, please.
Okay, I stop.
Okay. To the committee, so please show the certification or appreciation. Hello, the committee. Can you help us? Okay, dear Dr. Jahidul Islam, this certificate appreciation comes from the Dean of Faculty of Agricultural Science, Agricultural Technology, Universitas Gadjah Mada, from Professor Dr. Insinyur Eni Harmayani, Master of Science, given to Dr. Jahidul Islam from Tohoku University as a speaker of the 5th Smart Agroindustry Summer Course, Innovative Technology for Agroindustrial Sector in Society 5.0. So please receive it, and we humbly thanks very much for your time and contribution for this event.
Thank you very much. Oh, it looks very nice.
So following this appreciation, we request you to give maybe final statement, or maybe you have any suggestion or message to our student and participant, please.
Okay. Thank you, everyone. At first, I am so happy to share my topics, and I think you may enjoy. This is a little bit different from other talking, but it's very important issue for livestock industry, especially for agriculture, right? So I hope you all really enjoy my talking. And you can directly, you can find me. You can text me an email, so I can share more information if you're interested. And I really appreciate everyone to give me an opportunity to talk in your in your course. And especially thanks Dr. Wahyu, who approached me the first. And yeah, thank you everyone for giving me this opportunity.
Thank you very much, Dr. Jahid. So see you in the next year event or maybe in the other events. So once again, thank you very much.
Thank you.
Okay, thank you very much. And now I return the screen to the Master of Ceremony.
Okay, thank you so much to Dr. Jahidul Islam for the information, insight, and knowledge, and Mr. Wahyu Dwi Saputra that led the discussion in this session.
And before we move on to the next session, there is also a appreciation certificate for Mr. Wahyu will be given by the chairman of committee of the fifth Smart Agro and Industry Summer Course Program by Makbul Hajat, STP, Magister of Engineering, PhD. But due to the absence of Mr. Makbul, the certificates will be given in symbolize. And maybe before we move forward, we could documentation. Okay. In 1, 2, 3. Okay, thank you, Mr. Wahyu and Dr. Jahidul Islam.
Thank you very much. See.
Thank you.
Okay, now for the operator, please stop the recording.